This is Chapter 11, Part 3, looking at the skeletal muscles. Most names of skeletal muscles contain combinations of the word roots of their distinctive features. So you can learn the names of the muscles by remembering the terms that refer to muscle features, such as the pattern of muscle fascicles, the shape, the size, action, number of origins, and also the location of the muscle. Knowing the names of a muscle will then give you clues about its features. Here we have a table that lists out the characteristics used to name muscles. So this is helpful. You don't necessarily have to memorize every muscle, but you can look at or memorize the types of characteristics, and then it'll give you a clue as to where the muscle is or what it looks like. First off, we have direction. We have terms like rectus, which means parallel to the midline, transverse, which is perpendicular to the midline, or oblique, being diagonal to the midline. We have muscles like the rectus abdominis, which is going to be parallel to the midline, transverse abdominis, and then the external and internal oblique muscles, which are going to be diagonal. Another characteristic that we can use would be size, and this is relative size to the muscle, maximus and minimus being the largest and smallest. Longus and brevis are interesting, so those are long and short. Latissimus is the widest. Magnus, major are both meaning larger, and vastus means huge or the largest. We also name muscles based on shape, the relative shape of the muscle. So we're talking about things like deltoid, which is triangular in shape, rhomboid being like a rhombus or diamond shaped, pectinate meaning like a comb-like. What else do we have here? Quadratus meaning square, like the quadratus femoris, those kind of things. So we can look at different characteristics. In this table we have direction, size, and shape. And in the next table we'll look at a couple others. On this table we have characteristics like action, the principal action of the muscle. So we're talking about things like flexion, extension, adduction, abduction, these movements that we've seen before. Levator, depressor, these are all actions we've talked about in the past. So we have muscles like the flexor carpi radialis, where we're actually going to cause flexion or decrease the joint angle, or adductor longus, where we're going to move the bone closer to the midline or adduct it. We also have characteristics like the number of origins or the number of tendons of origin. So biceps is going to be 2 origins or bi. Triceps being 3 origins. We know these are like the biceps brachii and the triceps brachii. Also, location is going to be another large characteristic that we're going to name muscles from, like temporalis. This one is near the temporal bone, so some of the muscles are named according to the bones that they are near. Also, origin and insertion. So these muscles are actually quite easy to figure out where they are, like the sternocleidomastoid. So this one goes from the sternum and the clavicle and goes to the mastoid process of the temporal bone. So then we have sternocleidomastoid. So you can pretty easily figure out where that muscle is. So here we have a big list of some of the superficial anterior skeletal muscles, and we will look at a lot of these in more detail in the lab, but we will very briefly just look at some of the physiology of a couple of them. First, we can look at the orbicularis oculi. This is the circular path, or it has a circular path around the orbit, and its action is that it closes the eye. And it is actually innervated by the facial nerve. the orbicularis oris here. This is a circular muscle enclosing the mouth. So you can kind of see it. I'll do a different color here. You can see this muscle right here. So it encloses the mouth there. And this muscle closes and purses the lips. The orbicularis ori here, I didn't note that, but these ones here are around the eyes. Next, the sternocleidomastoid muscle. This is also known as the prayer muscle. This muscle right here. It goes from the neck, from the sternum and the clavicle, and then back to the mastoid process in the temporal bone. And we can have that bilateral contraction that flexes the head like you're praying. And we can also have unilateral contraction with this muscle where it'll laterally flex the head. And also we can also rotate the head to opposite directions, like when you shake your head no as well. Next, the latissimus dorsi, sometimes also just called the lats, are these muscles here. And these extend, adduct, and they immediately rotate the arm at the shoulder joint. The biceps brachii is going to be another main muscle here. Going to be a very large muscle here in your arm, and it flexes the forearm at the elbow joint and also flexes the arm at the shoulder joint. Also have the triceps brachii here. It's going to be behind, and we'll actually see it a little bit better on the next picture where we have the posterior muscles. We can kind of see it a little bit in the back here. And this muscle actually works to extend the forearm at the elbow joint and also extend the arm at the shoulder joint. Another major muscle of the torso is going to be the rectus abdominis. So these are going to be your abs here. So all these rectus abdominis muscles. These actually flex the vertebral column, kind of like when you bend over. And it also helps to compress the abdomen. This is to aid in defecation, urination, forced exhalation, as well as childbirth. Okay, let's look at some of the major leg muscles now. So the quadriceps femoris, this is a group of 4 major muscles. So these are going to be the rectus femoris, the vastus lateralis, the vastus medialis, and then also the vastus intermedius. And the vastus intermedius actually is deep to the rectus femoris, so you actually can't see it on this superficial picture, but know that it is one of the 4 of the quadriceps femoris muscles that make up your quads. So here we're going to have this side, that the vastus lateralis is going to be this side muscle. This larger one here is going to be the quadriceps femoris, and then vastus medialis is going to be right there. And these all work to extend the leg. The rectus femoris actually also works to flex the thigh as well, but all 4 of them work together to extend the leg. Okay, we also have this muscle here. It's one that kind of goes from your hip all the way across to the medial leg here. And this is called the sartorius. And this muscle mainly works to laterally rotate the thigh at the hip joint, but it's kind of cool because it attaches here at the hip and also here at the medial knee. So it's a very interesting muscle, different from some other ones. Okay, now looking at the anterior compartment of the lower leg, some major muscles here. We have the tibialis anterior, And this one works to dorsiflex the foot at the ankle joint and also works to invert the foot at the intertarsal joints. So that's going to be this muscle right here that goes from the lateral knee side to the medial ankle side there. Here, looking at the superficial but posterior skeletal muscles, we have a couple different ones. Okay, here near the head, we have the splenius capitis. This is a deep muscle of the neck, and it originates from the lower half of the nuchal ligament and the spinous processes of the seventh cervical vertebrae, and it inserts onto the mastoid process of the temporal bone. So it's going to originate kind of down here a little bit, and it's going to be deep to the trapezius muscles, you could see here, and it inserts way up here onto that mastoid process of the temporal bone. And this muscle actually acts to laterally flex and rotate the neck. And it also extends the head when both sides of the muscle contract, or both muscles on either side rather. So because it's deep there, you can't see it underneath the trapezius. But next we'll talk about the trapezius. So this is quite a large muscle here on either side. We're going to be coming out here and then also down here on both sides of the vertebral column. And this actually works to extend the head and also elevate the scapula. The deltoid muscle is going to be the next one. Let's see, it's going to be this muscle here over the shoulder. And this muscle works to abduct the arm at the shoulder joint and also medially rotate the arm at the shoulder joint and laterally rotate the arm at the shoulder joint. So different fibers within this muscle work to complete different actions of the shoulder joint, and that's going to be this whole muscle here. Okay, here we have a much better view of the triceps brachii, which is going to be this muscle here on the posterior side of the arm, and its action is to extend the forearm at the elbow joint and extend the arm at the shoulder joint. So remember, we talked about that one before, and this one is actually innervated by the radial nerve, and we will talk about all the nerves and their innervations when we talk about the nervous system as well. Another large posterior muscle here is the latissimus dorsi. So on the anterior view, you can kind of just see the little bit here where it kind of goes into the front side of the body, but here we see how large this muscle is here. This big, large muscle on either side of the back. And remember, it works to extend, adduct, and medially rotate the arm at the shoulder joint, and it also works to elevate the vertebral column and the torso as well. Okay, just a couple more here. I want to talk about the gluteus maximus, so this large muscle here. Cuts off about there. This is, it extends the thigh at the hip joint. It also laterally rotates the thigh, and it also works to help to lock the knee in extension. Okay, here in the posterior compartment of the thigh, we have a large muscle here, the biceps femoris, which is going to be this muscle here, that one there, and this muscle acts to flex the leg at the knee joint and also to extend the thigh at the hip joint. Next, in the posterior compartment of the leg, here we have the gastrocnemius. Now the gastrocnemius works to plantar flex the foot at the ankle joint and also flex the knee at the knee joint. The soleus here is also technically part of the posterior compartment of the leg, and it also works to plantar flex the foot at the ankle joint. Now remember that these muscles do not work independently to complete an action, and rather these muscles work together to complete like plantar flexion or extension or anything like that. These muscles aren't independent in producing that action. So these are going to be the two large gastrocnemius muscles, and the soleus are here going to be lateral and medial, kind of on the side, but you can't see them terribly well from this view. So here is a clickable anatomy review, so you can click on this link in your notes to look at muscles and their movements and to look at that overview there. And that's going to be the end of Chapter 11, Part 3.